I am Dr. Ken Rictor, and I am joined with two great people today. Garrison Bliss, who really could be thought of as the founder of DPC, really came up with the idea that we kind of all have looked and emulated. And Lisa Davidson is a family practice DPC physician in Denver. She has been DPC for 7 years, and she's part-time now, and she says she's enjoying the rest of her life from that aspect. And she also mentors a lot of DPC physicians. So it's really great to have these guys to get their insights. So we'll start with Garrison. And I said, I want to know and tell these guys, what did you see initially with the problem of a system that launched you to do something really so radical?
Well, that's a great question.
Thank you very
Glad
much.
you asked that. The thing I want to say first is that everybody thinks that this was an invention of a business model. And I want everybody to understand that it was not. The thing that changed the way I felt about healthcare was when I had been in practice for 3 years in internal medicine practice in Seattle. And my son got a brain tumor. And we found ourselves on the other side of that gun, which, you know, these are sort of transformational things, cancers and dealing with healthcare systems, and even nice healthcare systems, really nice healthcare systems, nice people trying to do their best work. But I kept noticing that this wasn't actually designed for me. And that the system was designed to be efficient for doctors and efficient for nursing and efficient. There are lots of professional people out there, and they knew a lot of stuff. They didn't know how to fix my son's brain tumor, but they knew a lot of things. And they tried everything, and he actually did okay in the long haul. And he just got married last year, actually. But while I was there, experiencing that, I began to ask the question, does my practice work well? Do my patients come there and feel like I work for them? Do they have the sense that I care? Do they feel like I spend enough time with them? That I answer their questions? That I listen to them? That I'm really on their side and I'm not trying to solve somebody else's problem? Some insurance company's problem or some government's problem or some billing issue or something else. And I started to look at the question in my own office, and then as we began to work through that, I began to say, well, if we can make this work in an office, why can't we make this work in a country that is notorious for incredibly expensive, very high-tech, 5-minute visit-driven healthcare? And so I began to look at how could you expand this? How could you make it go someplace? And the way it was actually invented as a separate entity as direct primary care, I do that periodically. The way that happened was that I sat down one day and said, well, what if you made a perfect healthcare practice? What would it look like? I spent about a year thinking about this question. How many patients would you have? How long would your visits be? What things would you be able to take care of in the office so that people didn't have to go anywhere else? How accessible does patients want you to be? What would that look like? And the answer is they want you really accessible. They want to have real time with you, and they want to have it work. So I sat down and tried to figure out what you'd have to charge for a practice like that, and how many patients you could take care of. And that business model was based upon a monthly fee, because I know no insurance company in the world was going to consider paying for what I was going to do. And then I discovered that you could do that in Seattle for $50 per member per month, and it would work. And then I was sold. And so since 1997, I've been doing it, and I've been trying to get everybody else to do it too.
Thank you, Garrison.
Sure.
So, Lisa, you echoed this. What made you jump ship?
So it's interesting. I don't know if I'm mic'd or not. Can you guys hear me okay?
Yeah, there you go.
If I stay like this. How many of you who are in DPC now have a compelling life event, maybe not as profound as what Garrison went through, but a compelling life event that made you say, like, I'm done? Raise your hand if anybody has. So many of you, I bet, have. I had one as well with my family, and I call myself the queen of part-time because my parents both, there were 4 of us kids, they were both teachers, they worked till they were like almost 80. They always said, like, we're gonna save, we're gonna go on trips when we retire. They both died before they could have any fun. And so when my mom died, she said, like, don't do what we did. Like, you need to live a life and you need to love what you do. And so that was my compelling moment. And if you guys all think about it, you probably all have one too, even if you don't know that you do. So I am the queen of part-time. I just was back in New Zealand 2 weeks ago, bungee jumping off the Warangi Bridge. And I work 3 days a week, and I have an amazing patient population. It took a long time to get there, but I am happier than I've ever been in my entire life.
That's awesome.
And that's what
Thank
we
you.
all say.
That's great. So between the two of you, again, you started in 1997. We've got 20 plus years of this thing. What things have you seen change in medicine and DPC over this 20 and then 7 years?
Well, part of the driving force of this, being able to, going to a monthly fee practice was and realizing that no insurance company was buying, part of the driving force there was that I was concerned about the frenetic nature of healthcare right now. Because it's fee for service. So the more fees, the more pseudo service, the more money. And I was afraid that we were going to get massively frenetic and that primary care would have to be frenetic because the payment per visit was so small that you'd have to be doing all kinds of things you didn't have to do. You'd have to be doing labs in your office that you didn't need to do. You'd have to get an x-ray machine because it could make more than you would make. I saw all of this stuff evolving in healthcare, and I was concerned that that was just going to continue. Primary care was going to become impoverished, and eventually it would have to seek help from the big clinics and from the hospitals that need their referrals. And in fact, that has now happened. The frenetic nature of healthcare is incredible now. You can't get an appointment with a specialist because they're so busy doing stuff that most of which shouldn't be done. And you can't, everybody's lined up to be processed. And so the problems that were there are still here and getting worse. The government, which has been trying to fix this problem for as long as I can remember, has done nothing to fix it, and in fact have made it worse and are about to do it again. And so it is, the things that have been going on in the healthcare world itself demand better primary care. We're the only people who can fix this problem. Nobody else is going to do it. And we're the ones who are motivated. And with this business model, you can make a living doing that. And so this is a weapon against an overreaching, expensive, invasive healthcare system. It's us. So that's why I'm talking to you guys.
In terms of the DPC movement, it's actually been really fun to see because I think I was telling Garrison when I first told my patients about DPC, it's like, when your dog is confused when you talk to them, and the patients would go, like, they did not understand it. And I would tell my specialist friends, and they were like, well, good luck with that. Let me know how that goes. So now people call the office every day, like, I'm looking for a DPC practice. And so it's transformed, and the roads have been paved, and people know who we are, and it's easier to get into, and it's easier to market before you even open. And so it's grown by leaps and bounds. You look at the DPC Frontier map, and it's just like crazy. Oh.
That sounds great. We've all heard, we're here most likely because we see dysfunction in the healthcare system. And one of the things that I think we look ahead is that we're also far-reaching people, and we're saying, how can we advance our practices, how we can grow our practices, how can we have a bigger footprint, what can we do to transform the healthcare. Most recently, I heard a statistic that 2025, it's predicted, if rates go as they're predicted to go, that the average cost for family health care coverage will surpass the average household income in the United States. So obviously, that's unsustainable. So the question out to you guys is, where do you see healthcare going in the United States? This is a far-reaching prediction. And where do you see DPC going, and what role will it play? Start with you, Lisa.
Oh, you're going to start with me. That's a huge question, and we have 4 minutes to talk about it. So, that's the funny part, is I feel like all of our DPC practices are like these little sort of sanctuaries for patients, and we're like a fallout shelter, and the world is like falling down around us, and we're trying to just protect our little islands. And the more of us there are, the stronger our sanctuaries can grow. And so I think our job as DPC people is just that's why I like to mentor, is like, let's get as many of us out there as we can. Let's get the specialists involved. Let's get the hospital systems involved. We have a few already. That's the most we can do, unless you want to run for office. And I don't think that's going to work either. So a huge question. That's my tiny answer. And I'm going to have Garrison give his opinion too.
Okay.
Well, I think that you can look at two different answers to that question. Because what's going to happen in the healthcare system is going to depend on what we and others do. It can go either way right now. The thing I will guarantee is that the existing healthcare system will get more and more crazed if we are successful. The attempt to shut down this movement will increase, I think. Because we are a genuine threat to the income of a system that's currently charging roughly twice as much money as we need to charge for services like this, and we can do it better at half the price than we're doing it at the current price. But there's a lot of things that don't happen when good care is in place. There are people who do not need not everybody needs their knee replaced the first time it bothers them. There are a lot of things that happen on a regular basis that are all paid for, that if in a system that actually worked would be funded a completely different way. So there's two ways it can go, really. If this movement continues to grow, and if it is allowed to grow, and there will be many barriers. You know, we've passed laws in 25 states already to make it legal at the state level for us to charge a monthly fee for healthcare. The weirdest thing imaginable. And we're currently in our 12th year of trying to get a one-page bill through Congress that says the same thing and allows us to make use of HSA money, if our patients have HSAs, to pay for our service. There are critical events that will determine whether the American healthcare system simply spins off into some kind of perverse, too expensive to afford, break your country's bank kind of system, or we actually rein it in and fix it. And we will be, if we're going to do that, we will be the engineers for that process. And I think it's important that we think of it that way. And that, more importantly, apropos of my earlier remarks, that we should not be thinking in business model terms. We should be preserving the care system that this is built on, because that's the magic. Whether you pay for it by the month or by the piece, the magic happens in the room. You guys are the ones who do it. And if you're going to do it, make sure that whatever business we get into and whatever deals we do will allow us to continue to do that. That's how we move in a sensible direction. And eventually, things will right-size if we're successful, and they won't if we don't.
All right, we made our time limit. We're all set. So enjoy the rest of your day. Get to know everybody else. These are wonderful people all in this room. Thanks for being here, and thanks for you guys very much. Thank you.